Guys, welcome back to the show. Today we are busting some of the biggest health myths Nigerians have believed for years. I am here with a medical expert, the one and only MD of Jogilet Hospital, Dr. George Okorafo. Hi, doctor.
Thank you, Mary Jane.
How you doing?
I'm good.
Okay, that's lovely. So, there have been so many myths Nigerians have believed, health myths. There's so many health myths Nigerians have believed for years to be the real ideology of some medical conditions. So today, I want you to bust some bubbles. I want you to, expatiate, elaborate, everything you can do to break the myth down and tell us if it's actually what it is. And if not, tell us why people believe it to be so. First myth in my list is malt and milk cures ulcer. Is that true? How true is that?
Talking about myth. Myth actually is more like a general belief. People just don't know how or when I say it's handed over from generation to generation without any scientific proof about them, and we're going to be talking about that. So the first question you asked is about, or the first myth we're going to be handling, you said why malt and milk
cures ulcer. Yes.
That is no, that's not possible. Okay, first of all, let's understand what ulcer is all about. I'm going to describe ulcer. When we talk about ulcer, we're talking about the peptic or gastric ulcer and all that. Now, I'm going to describe what it is with a layman's explanation. Ulcer is just like injury people have in their stomach. Now, those injuries there occur as a result of abuse of some medications and make somebody develop ulcer. The chief cause of this ulcer is as a result of infection called human papilloma H. pylori. Not human papilloma, I'm sorry. Helicobacter pylori, sorry about that. So that is the main cause of ulcer. The bacteria called Helicobacter pylori. That's H. pylori. Now, when this bacteria is present within the stomach, the byproduct they produce is like a human being, you produce waste. The waste they produce help in destroying the protective lining of the stomach. Inside our stomach naturally has acid. That is, the level of acidity is that of the same acidity in a battery. But God have this protective lining that protects the stomach, that level of acidity will not destroy or will not harm us while it's there. So when this bacteria that is there, when they produce their byproducts, those things destroy this protective lining of the stomach, thereby injury occur. So if we understand the process or what a disease is, I'm taking my time explaining with this layman's concept, so that we all understand what what ulcer is all about, so that we will not be deceived, whether in the treatment or whatever is happening. If you have ulcer, you will now have a better idea of what is going on with your body and how to address it. So as I was explaining, it's an injury that is there, and you now have an acidic medium that is also in that stomach. So imagine when you have a wound, an injury to the protective lining of the stomach, that acid will now be burning, acid burn flesh. That is the reason why some people keep having chest burn and all that kind of thing. So that chest burn come when your body produces those acid and it enters into that place where the injury is, the person will feel chest burn. So this is what ulcer is all about in a layman's understanding. So we can't be talking. So when we want to treat the patient, there are things we do. You give the person medications that will kill this infection if it is there. You give the person medications that will reduce the acidity of the stomach to help healing to occur. Because if there is something, it's like when we're small, you have injury on your foot. During we played ball. Those days we were still very, very small. When you go out to play ball, you may have injury on the big toe. So and it's about healing. After some time, you use it and go and play ball again. It will the injury. So when you have those acidity in the stomach, it will keep causing the injury that maybe that is about to heal to injure again, you now find that the ulcer will remain, for a long time if the proper thing is not done. And that's why sometimes some people believe ulcer sorry
It's
for using that,
uncurable.
that
Yes,
people,
yes.
the ulcer doesn't get cured. So it's because of the misconception. So when you now understand this, you now know how you go about treating yourself. So we'll give the person, as I said, medication that will eradicate the bacteria that worsens it or that complicates it. You give the person medication that reduces the acidity of the stomach so that the injury can heal. Then sometimes you give person medications that will help protect the site of injury from maybe further the acid affecting it. That is like the NSAID we take and all that. Especially if you take that NSAID, you feel relief. These are things that just help give you a symptomatic relief. So that is what ulcer is all about. So tell me how what did you call it say before? Malt
Milk.
and milk. How will you address this problem? Please, you should answer that.
The next myth on my list is herbal mixtures are safer because they are natural. To me, I think, there was a time I could think that. I mean, it's a natural myth, so what do you expect? I also think that. So what do you have to say about this?
Well, I totally disagree with that for some reasons. All right, let's go back a little bit to how some of the drugs we use, how they are produced. The medications we are produced are also produced from the natural, most of them are also produced from the natural sources. There's a lot of extract that and all that, and the active ingredients gotten some refinement processes occur to produce together medications we normally take. Then they are now covered with carrier or some things to package the active ingredient, because the normal thing that makes the drug work is very tiny in that thing you see as maybe, let's say, paracetamol. The other ones now sound like package to make it look. Are you getting me? Now, then after they must have finished doing all that, the drug, they start what they call the preclinical trials. Drug is sent, is used in animals and all those kind of things. Then after the preclinical trial, it takes a lot of years with a lot of government agencies monitoring and following and ensuring that these things are safe, no side effect in the animals. When they are done with that, they now start the clinical trials where human subjects are now used. People volunteer to be used as some of the subjects for these medications, and they do all that, and this thing take a lot of billions of dollars, a lot of money, a lot of time, and eventually the drug is approved, it enters the market. Most of that's how new drugs are produced. Now, can we say that that is good compared, or is better compared to somebody who goes take a route? Because some people go like that same route that solve the same problem. The person will take the route, extract everything that's using the normal extract, or using alcohol to extract it, and drink like that. That is as good as putting crude oil inside your car. And most times, so that is it. Because when you do that extract, there's a lot of impurities that come with the extraction process. When you use things, liquids that extract some of this chemical component in our leaves, in our roots, or in the back of this natural thing. So I can't agree, or there is no way taking herbs will be better.
Okay.
Because, sorry for cutting you, there's a lot of side effects that comes with that that we don't know. Unlike, for instance, the English medication that has gone through a lot of refinement, and it now end up as capsule or tablet we take. So please, let's be careful. I've seen quite a lot of people with renal failure, kidney failure, caused as a result of herbal intake. And the truth thing, the truth about it, that the person giving it to you doesn't even know these problems exist. They are just take it too short, take it. Do you know, okay, what benefit will it give you to take a herbal medication that will cure you malaria, end up giving you blindness? Or what good will it give you that you end up taking a herbal medication that will end up curing your diarrhea and giving you kidney failure? We must have to take care of ourselves and ensure that the things we are taking inside us is good for our health and has been proven by so many, because when you're doing clinical trial, you're talking about different cultures, different race. They do all this in some media reports that this thing has been proven beyond every reasonable doubt that this is safe. Please, let's take care of our health. All these roots people take, all these herbs people take, they are unsafe. If you want to take natural things, please go and take fruits and vegetables. These things are natural things. It wasn't made for the minerals and the vitamins that will help you sustain your health. Now, but once you start going to roots, going to bark that is extracted, please run away from there. I just gave you the analogy. It is just like taking crude oil and putting it inside your car, and you know what will happen to your engine. Thank you.
Well said, because most of the things you mentioned is exactly the causes, the side effect of this herbal mission. We have another myth here. They said body pain and fever always means malaria. I mean, that's a general theory. Of course, even me, I feel that way sometimes,
It's something we see in health. Like, in fact, putting it right, they say malaria and typhoid. As if the typhoid is the wife of malaria. They cannot exist separately. The ones that come, they really want to make that say, doctor, I'm having malaria. It's typhoid and malaria. So sometimes every headache, every fever is not malaria. Every headache, every fever is not typhoid. So please, let's take note. There are other diseases that occur within the body that will give you similar symptoms. Most bacterial infections will also give you similar symptoms. So please, in fact, the day I knew this thing this myth has gone far. One day, I think Egyptians that are running a company in Nigeria, they've been here for some time, they're into furniture making. So the man came, you know how they are very white and all that. And I was like, doctor, I'm having malaria. I was like, whoa. So this thing has also this myth.
Like, why you say you have malaria? What's the...
And the funny thing is that for what he's describing, he has most likely an upper respiratory tract infection based on the symptoms he was presenting. Malaria will not be giving you cough. So please, let's take note. Every fever or every body pain is not malaria, neither is it typhoid. Typhoid is not as common as we thought. Please, let's take note. And please, let's try to play this.
Okay, we have another myth here. Another one is taking malt and milk gives blood. Before they said taking malt and milk cures ulcer. Now they said taking malt and milk gives blood.
And this one is also very common. If you go to most of the lab, even within our environment, after the transfusion, I need malt and milk, before you go replace it. This is wrong.